Radiosurgery is a way to minimally invasively treat conditions, mostly tumors of the brain or spine. Tumors are the most common thing. There are other conditions or malformations that can be treated with radiosurgery, like arteriovenous malformations or trigeminal neuralgia, but probably tumors are the most common thing we treat with radiosurgery. It involves giving radiation to the lesion in a very specific manner that's non-invasive.
Stereotactic radiosurgery is a non-invasive treatment technique. Initially, we acquire a set of images that are especially high resolution, and with the use of special equipment that allows for sub-millimeter precision, we're able to bring the patient in for a single treatment session and in 30 to 45 minutes deliver a precise dose of radiation therapy that is adequate to destroy a tumor.
Stereotactic radiosurgery is good at treating multiple different types of conditions or lesions of the brain. The most common being brain tumors. That can be a benign tumor or a malignant tumor, a tumor that's spread from somewhere else, or a tumor that started in the brain. So most of the studies that are done with radiosurgery involve treating metastatic tumors, tumors that have spread from somewhere else, such as lung or colon, skin cancer, melanoma, things like that. And the radiation kills the tumor cells that are dividing and hopefully leaves the cells around it normal. The other types of tumors, like meningiomas or schwannomas, are benign tumors usually, but sometimes when they grow large enough they can start causing symptoms in the brain, and those can also be treated with radiosurgery. Tumors of the spine can as well. Most of the spine tumors treated with radiosurgery are also metastatic tumors, or tumors that spread from somewhere else in the body.
Highly specialized equipment which allows for the delivery of stereotactic radiosurgery will ultimately result in better disease control and substantially improved quality of life and fewer side effects and toxicities from conventional therapies.
The machine that delivers the tumor has a way to focus the radiation beams so that the tumor gets a maximal dose of radiation and all the surrounding normal structures around it get a very minimal dose. This is different than conventional radiation that what we used to do for brain tumors would be something called whole brain radiation. So the entire head gets a large dose of radiation and the normal brain and the tumor get the same dose. The tumor dies because those cells are actively dividing, and so those are very sensitive to radiation. The other cells in the brain are not actively dividing, so they're more resistant to the radiation, but they can still be affected by it. So one of the downsides of whole brain or conventional radiation is the side effects to the normal brain. So a lot of people that may have had metastatic cancer to the brain, multiple lesions that were treated with whole brain radiation. They may have survived the radiation, but then had long-term problems from the radiation that involved the toxicity to the brain cells. With radiosurgery, it takes involvement of several different specialists, usually the neurosurgeon and the radiation oncologist, but there's also a lot of other people involved, the radiation physicist, technicians that are involved in delivering the radiation. But the neurosurgeon's role is really to help determine what is radiosurgery the right treatment for this patient. A patient with a solitary lesion, maybe in the early stages of cancer that spread from somewhere else in the body, that just has one solitary lesion in a location that's favorable for resection, that may be the best treatment for them, undergoing conventional surgery where we drill a hole in the skull and remove the tumor and treat it that way. Whereas sometimes if it's in a location that's difficult to safely remove surgically, we may elect to treat it with radiosurgery. So that's part of how the neurosurgeon gets involved in that decision process.
My role in the process is to work hand in hand with our neurosurgery colleagues in consulting the patient, advising them of appropriate treatment options, and ultimately moving forward with planning a patient's treatment and supervising that treatment delivery.
having the stereotactic radiosurgery capability here is a big plus for us. That was one of the few treatments we had to send patients to Dallas or other places to have done. Now that we have that here, patients can stay here. There's lots of studies that show how patients benefit from not having to travel very far to get treatments. This is just another tool that we have to provide a complete care for the patient's neurosurgical problems.
We're incredibly fortunate that Hendrick Medical Center has made substantial investments in the technology that we utilize to fight cancer. And with this investment, it has allowed us to offer stereotactic radiosurgery so patients no longer have to travel to Dallas or Houston for their care.